Good afternoon, everyone. Thanks for joining us on the news briefing for this Wednesday. We'll get started with Dr. Moreno from our health department. Dr. Moreno will be answering some questions today. If you have questions for the doctor, go ahead and put them in chat. I do have one already for you, Dr. Moreno. Are you ready to start with questions?
Yeah, good morning. Good afternoon. I'm ready.
Good afternoon. So my first question for you is there a COVID outbreak at the Monterey County Courthouse?
Oh, thank you, Matt. No, actually, I can't comment about outbreaks at this time.
Okay. Next question, and go ahead, if you've got other questions, now is the time to put them in chat. Next question, Dr. Moreno, how effective are cloth masks in preventing Omicron transmission?
Thanks, Matt. So I think the important thing people should remember is that we're still under a state health officer order requiring people to wear face coverings when they're in public indoor settings. And aside from that, the next important thing is to make sure that you have a good fitting mask. So the recommendations currently are still to have a two-layered face covering, and also that the face covering fits tightly around over your nose, on the sides, and covers your mouth and a tight fit under the chin. In terms of, in addition to that, but that would help all of us in our community prevent the spread. So if someone has COVID, whether they know they have COVID or not, if they're wearing a face covering, it can prevent the amount of aerosol droplets transmitting through the air and possibly exposing and infecting other people. If there are any individuals that would like a further layer of protection for themselves to prevent their own exposure, there are higher level masks that provide that protection, like a K95 and N95, but that also has to fit tightly around over the nose, on the sides, and under the chin, and cover both the nose and the mouth. So the face coverings, more evidence continues to show that face coverings can reduce transmission of COVID from people who are infectious to other people and help slow down the spread of the COVID-19 viruses.
Thank you. Next question. Would you support efforts to standardize cloth facial coverings so that they offer greater protection against COVID-19?
Again, I think the important thing is that people understand that there's guidance out there right now that we're following from the California Department of Public Health, and it's really important that people follow that guidance. And if anyone has further questions about face coverings, you can also call our COVID call center at 831-769-8700.
Thank you. Next question. Do you have any projections or thoughts on when the Omicron variant will peak and fall?
So at this time, we have about 3 weeks of experience here in Monterey County with the Omicron variant. We continue to see a greater proportion of the viruses isolated from patients with COVID-19 turning up Omicron. So with the last few runs of genomic sequencing on our specimens, it's about 80% Omicron, 20% Delta. And what was the last part of that question, Maya?
Projections on when the Omicron variant could peak and then the surge could end.
Right, thanks. So we have just a little bit of information. So I think what we're relying on at this point is California Department of Public Health experts who are looking at other communities that look something like our community and have more experience with Omicron than we do. So currently, California Department of Public Health is looking at the United Kingdom and looking at New York. They detected Omicron before we did, and they have more experience with Omicron. So the California Department of Public Health will be looking at that, and we'll see if they have any ideas that can help us in planning and responding to this Omicron variant.
Thank you. Next question. What is the case rate and test positivity rate in Monterey County now, and what were they last week?
That information is on our website, Maya, and if you like, when this is over, I can maybe get that information from last week for you.
Thank you. And it also comes out for those who get the fact sheet, that it comes out, last week's numbers would be in the fact sheet that you could reference. And we can also send out those numbers later. Next question for you, Dr. Moreno. Why does Monterey County have a much lower case rate than the state average?
That's a very good question, Maya. Not really sure why we have a lower case rate. We can just go back and describe what we saw early on in the pandemic. What we saw with the last winter surge, we saw that Monterey's case rate was about equal to California state average case rate. We were experiencing quite a bit of COVID infections here in Monterey County. For one reason is when the surge started, we hadn't yet started vaccinating individuals, but also we had a lot of frontline workers, essential workers who couldn't shelter in place or couldn't work from home. So unfortunately, we had a lot of people coming down with COVID. So at this point in Monterey County, I think, don't know for sure, but we suspect that our population has some immunity from a combination of having been infected with COVID-19, possibly more than once, and also the result of a lot of effort to try to get people vaccinated, not just with the initial series, but getting people who are immune compromised, getting them their third shot, and then encouraging people to get a booster when they're eligible.
Thank you. Next question. What percentage of testing samples go through genomic sequencing to determine if the sample is of the Omicron variant?
What I can do, Maya, is if you send me that question later, I can see if I can get some information on that for you.
Would it be fair to say that it's a small number of samples?
I think the person's probably looking for a number. So if you give me that information, I can try to see if I can get a response.
Okay. All right. Next question. The case rate this week looks to be almost 5 times what it was last week. Why do you think that is?
From what we've learned is that the Omicron variant is highly transmissible. Many of us are doing our best to wear face coverings to avoid being in crowded situations and keeping our gatherings small and getting vaccinated. But despite that, this variant is more contagious than previous variants. So when one would expect to see more cases when an infectious agent is more contagious. Fortunately, it seems though the early studies show that this variant isn't as virulent, meaning it's not causing as much serious illness, which means that a lower percentage of cases are being hospitalized, and possibly we'll see a lower percentage of cases dying from this variant. So there is some good news there, but we do need to try to continue to do our best to slow down the spread of this virus, because if the numbers get too high, even though we might have a lower percentage of hospitalizations, the total number of hospitalizations might be overwhelming for our hospitals. So keeping our hospitals in mind, and keeping in mind that if you or I or anyone else needs to be hospitalized for something other than COVID, we want to make sure that the bed is available, and the bed is staffed with qualified, healthy, rested healthcare workers in our hospitals. So we need to protect that healthcare system so it's there when we need it.
Thank you. Next question. Of the 63 people hospitalized in Monterey County, how many people are in the hospital with COVID as opposed to because of COVID?
That one would be difficult to answer, man. That's because we do have ongoing attempts to try to reconcile the information that's coming from hospitals, determine which are individuals who were hospitalized because of COVID and which ones incidentally had COVID. And so that's an ongoing issue, and we do our best to try to understand that, but I don't have that information for you, man.
Next question. Is the test positivity rate up because we are testing more?
I think test positivity is up because what we've seen in the prior surges here in Monterey County and in California, that test positivity is a reflection of how much the virus is transmitting in the community. And as test positivity goes up, which is an early indicator, we start to see that cases start to go up, which case rate is also an early indicator. So test positivity, again, is an indication of how much the virus is transmitting in Monterey County. So an increasing positivity rate means that there's more increasing transmission in Monterey County. So that would explain it.
Next question. Is the county seeing a shortage in testing supplies?
So there are a variety of options that we have here in Monterey County to test for COVID-19. We've been utilizing for quite some time now the PCR test. Those are the tests that are run at the LHI, or otherwise known as OptumServe sites here in Monterey County. Many providers are also still relying on PCR testing as well to do to conduct testing looking for COVID-19. But as time went on, we know that there are other modalities for testing that come on board. That includes the over-the-counter tests, which is a person can do at home, and also the CLIA-Wave tests, which are the tests that a healthcare provider can do in the office or in their own laboratory with a quicker turnaround time. So we have a variety of options available to us, and as we go through this pandemic, and as the pandemic has an impact on the economy, on businesses, on our supply chains, I think it's really important that we as a community understand that there are a variety of options, and that the type of test that we want when we want it may not always be available. And so I really highly encourage people to be flexible, to understand that we do have other modalities and other options available to us. And in this case, there seems to be an increased demand for the over-the-counter tests. Many of the pharmacies are out of stock. People are asking for it because they want to test before they travel, before they gather, after they return from travel. They've been advised and instructed by their employer or from their school to test as well. People want to follow CDP's guidance and maybe test at day 5 to get out of isolation or quarantine early. So the demand has gone up as the usefulness of these test kits has also increased. But again, I would really encourage people to look for other options if they can't get it. So right now, we still have PCR tests at our OptumServe sites. That's at the Salvation Army in Seaside, the Sherwood Park in Salinas, and Soledad Library. And so I would suggest, though, if someone is planning on getting a PCR test or scheduling an appointment for a PCR test because they can't get their hands on an over-the-counter test, and if they know when they're going to test, that they schedule an appointment as soon as possible. I wouldn't recommend that someone wait till day 5 to try to schedule an appointment for a test. I would say if someone's tested positive on day 1 and on day 1 or 2, that's when they should be looking to make an appointment on day 5. If they wait till day 5, it'll be much harder to get an appointment. The other thing is that if you're an employee and you're looking to test, I highly encourage you to talk to your employer. Your employer may have some options for testing. If you're a parent of a student and you want this, I'd like to have your student tested, contact your school. Schools have received shipments of over-the-counter testing from the California Department of Public Health, and many schools have picked up those tests from the Monterey County Office of Ed. So call the school to see if there's testing available. As far as the general public, I continue to check with pharmacies. Pharmacies get shipments periodically. Check with them to see if they have tests available. You can also call 211 to see if there are any other opportunities available to get a hold of the over-the-counter COVID-19 test. People can also go to our Monterey County Health Department website, where they can identify many more testing options for them. And if a person who's required to isolate or quarantine can't get an appointment for a test or can't get a hold of an over-the-counter test, there's also state guidance that recommends that people isolate or quarantine for the full 10 days. So that's still an option for people if they can't test, and it's an effective strategy for slowing down the spread of COVID-19. And again, if people have questions about isolation and quarantine, they should, if they're an employee, they should call their employer to speak with the HR department. Otherwise, people can call 831-769-8700 here at our health department, and we'll do our best to answer your questions.
Thanks very much for that really thorough answer on that one. I have one more question for you. Will we see National Guard troops at state testing sites in Monterey County?
So the National Guard has been called out to some locations in order to provide assistance with the staffing. So that is something that may be an option to us if we find that we need that additional staffing. In the meantime, here at the health department, we continue to do our best to ask for people to sign up to volunteer, to assist us with all of our COVID response efforts. And hopefully we'll be able to continue to bring on enough people to respond to the level that we need during this surge and after the surge and with any other surges that may follow.
Thanks very much, Dr. Moreno. That's all the questions I have in chat. Are there any other questions for Dr. Moreno before we let him go for this week? I'm not seeing any. If any come in, we'll forward them to you. Thanks very much, Dr. Moreno, for joining us today.
All right, good afternoon, ma'am.
Now we're very pleased to have with us some doctors from our local hospitals. They're going to share with us information about COVID impacts at those facilities, but also reinforce those really important health messages about testing and masks. So we're very pleased to have Dr. Mahendra Padel from Salinas Valley Memorial Hospital and Dr. Casey Grover from Community Hospital. Thanks very much, both of you, for joining us. Dr. Padel, let's start with you. Tell us what's happening at Salinas Valley.
Sure. Thank you. Thank you for this opportunity to be present here and share our experience. So at Salinas Valley Memorial, as of this morning, we have 28 patients who are hospitalized with COVID. 4 of them are in the intensive care unit on mechanical ventilation. Most patients seem to have mild to moderate illness with a little bit of oxygen requirement. Compared to what we saw a year ago with the Delta variant. Most sick and critically ill patients seem to be either unvaccinated or with a weak immune system. And we're seeing an increasing number of patients that are coming in with non-respiratory illness and testing incidentally positive for COVID-19. So it just speaks that there is a significant amount of community transmission going on.
Thanks very much, Dr. Padel. Can you also talk a little bit more about the Omicron variant, about how, as people have a lot of questions about being hospitalized with COVID or being vaccinated or unvaccinated?
Sure. So this Omicron variant seems to be extremely efficacious in terms of transmission. So it really spreads very fast and very quick. The symptoms of COVID-19 sort of differ in terms of patients' vaccination status, their age, and what type of immune system they have. If you're fully vaccinated, you may either not have any symptoms or have very minimal signs and symptoms of what we call a common cold, meaning if you're fully vaccinated, the virus does not seem to go down into your lungs and it stays mainly in your upper respiratory tract. So mainly like sore throat, running nose, body aches, and fatigue. These are some of the symptoms that these vaccinated patients are telling us. If you're not fully vaccinated, meaning if you just have received the 2 doses of the mRNA or 1 dose of the Johnson & Johnson vaccine, the symptoms are similar, but they're a little bit more severe than in somebody who is fully vaccinated. The patients who are coming in really sick, symptomatic, with difficulty breathing, low oxygen level, seem to be either unvaccinated or patients with weak immune system. And loss of taste and smell that used to be like the telltale sign of COVID, we're not seeing that very commonly with this Omicron variant. So overall, this Omicron variant, although it's very infectious, it seems to cause less severe symptoms, especially if you're vaccinated, but it is still causing a lot of hospitalization and patients are still dying from it. And it is still putting a lot of stress in our healthcare system, which is already stressed.
And then there were some questions earlier about masks, what the best mask is to wear. Could you talk about perhaps best masking practices? What mask should people choose to wear?
So the Omicron variant seems to be really more transmissible than the previous variants, the original variant or Delta, and it seems to be spreading really fast. So masking is one of the public health measures that can slow down the spread of infection. So and then the guidance in masking has also been constantly changing, just like everything else in this pandemic. as of now, N95 masks seem to be the most effective in preventing the spread of infection. But I would keep in mind, these are also very cumbersome to wear. You need to be fit tested, and they're not very comfortable to put them on for a whole day. And then we also have KN95, which are the N95 equivalent of Chinese CDC. They are probably less effective than N95, but more effective than the regular surgical mask. Surgical masks seem to be, they seem to be okay, but not as effective as N95 or KN95. And the cloth masks seem to be almost of minimal benefit for this Omicron variant. So, cloth masks, they're almost useless, what we have found based on the evidence. So, these are the masks that are available. And I think the bottom line is any sort of mask probably better than none, but in the descending order of efficacy, it's N95, KN95, and then surgical masks.
I hear people talking about double masking. So if maybe only surgical masks are available to somebody, maybe doubling up with a cloth mask?
Yeah, I think that's probably better than just using a single layer or not using any. And you can double mask 2 surgical double masks, or if you only have 1 surgical mask, then you can double up with a cloth mask if you don't have access to N95 or KN95.
Thanks very much for this information. Please stay on with us in case we've got some questions. We'd like to turn to Dr. Grover now to tell us what's going on at Community Hospital. And then I'm hoping you'll talk a little bit about the emergency room. How should people be looking at the emergency room right now?
Yeah, excuse me. Thanks very much for letting me join today. I worked in the emergency department till 1 a.m. last night. I worked over the weekend. And I think our experience at CHOMP has been similar to that at Salinas Valley. Omicron is clearly here. The symptomatology is slightly different than what we were seeing with Delta, and it's very prevalent. Our experience at CHOMP has been the same at Salinas Valley, that those who are vaccinated, particularly those who are vaccinated with a booster, are presenting with much less severe symptoms, even in high-risk categories. So patients over the age of 65, patients with chronic lung or heart conditions, we're seeing they are less likely to be ill and hospitalized when they have received their vaccine and booster. As far as numbers, we have 20 patients currently admitted at Community Hospital, with 5 in the intensive care unit. And most recently, the positivity rate for our testing has been 24%. And just anecdotally, early in December when I'd go to work, I was seeing maybe 1, maybe 0 COVID tests in a shift. And now I'm seeing as many as 6 or 7. So clearly we feel it, and we're seeing patients come through our department. And again, like Salinas Valley, we are seeing the effect of this on our emergency department and the hospital itself.
So for folks who need the emergency room, what could be their rule, what could be their thought if they need how should they choose? Do I need to go to the emergency room or not?
Yeah, of course. So I think the first part of it is that the emergency department, the first word is emergency, and that's really what we're best at. And in some ways, if a person is asking themselves, I wonder if I have COVID, that's probably not a good use of the emergency department. On the flip side, if a person either says, there's something really wrong, I can't breathe, or I'm having severe pain, or I'm vomiting, or I know I'm positive for COVID, I can't breathe, I'm having severe pain, I can't stop vomiting, that's when we're happy to help. I think the idea would be is if someone feels like there's something really wrong or they're having severe symptoms, all of the emergency departments in the county are doing the best they can to be able to see patients quickly. But unfortunately, an emergency department only has so many doctors, nurses, and beds. And so if everybody comes in thinking, hey, maybe I have COVID, I'll go get checked out, it slows down the time for everyone to be seen. The more people that come in at once, the slower we are to see everybody. And our goal is to see everybody as quickly as possible and to make sure that we're able to evaluate patients properly. So again, kind of the answer is, if you think something's really wrong or you're having severe symptoms, that would be a good reason to come to the emergency department.
And then finally, I'm wondering if you could talk a little bit about testing. There are a variety of people say testing, but there's a lot of different tests and ways to use them and values for each one of them. Can you talk about what tests did you choose at what point you're at?
Absolutely. So, and Dr. Padel, if I goof anything up, please feel free to correct me. So I think there's basically two types of testing. And we as physicians at the hospital have various reasons why we might use them. But in general, the first type of test that people probably recognize the name of is a PCR. And that's a test that detects the genetic material of the virus. And that is the most accurate test, meaning it's most likely to pick up an infection as soon as it's detectable. The upside of a PCR test is that it picks things up as early as possible. It's considered the gold standard. But the way the test works, a person might have a little bit of genetic material of the virus for months. And so at our hospital, if somebody tests positive for COVID, we don't repeat a PCR test for several months because the test isn't helpful. We know they've been infected and we know they're going to test positive for several months. That's kind of a test characteristic, if you will. So when there's this recommendation to test after 5 days, if we use a PCR test, it's not going to change anything. For us at the hospital, we want to be as accurate as possible. So if somebody comes in and has respiratory symptoms, I'm often ordering a PCR test because I want the highest sensitivity or the ability of the test to detect when someone's actually sick. Similarly, if someone's going for surgery and they're going to be on a ventilator and there's a risk of spreading aerosols from that person while they're on the ventilator, we're going to want to get a PCR test. The at-home tests are what are called antigen tests. They detect pieces of the viral protein. They tend to turn positive a day or so later than the PCR test, but they will also turn negative much sooner. An example might be somebody who's vaccinated and boosted who tests positive because they've got a little bit of a runny nose, might only have a positive antigen test for 5 or 6 days. And so when people are talking about getting tested to go back to work, that's the type of test that they're referring to, which is what's called an antigen test. In our emergency department, we don't have that test. I had someone come in last night and say, "Doctor, will you please test me? I'm 10 days. I want to know I'm negative." And I had to tell her, we only have the PCR in our emergency department, which isn't going to be helpful. So I think when people ask their healthcare practitioner, it's, if I need a test, what type should I get? And then number two, what type do you have available? Because again, for us in the emergency department, if someone comes to get tested to go back to work, we just don't have those tests available.
Really great information. And thanks really for running it down in layman's terms for people to understand the tests. I don't have any questions in chat for you. For both of you, gentlemen, can you tell people what is it that we want people to do right now, where we are in the pandemic at this point? We've got a new variant, we've got new concerns. What is your advice to people about how to get through this next phase? And anyone can start.
Yeah, I can pick that up, and Dr. Grover can maybe piggyback on it. We've been in this pandemic for over 2 years now, and there's a lot of frustration, and especially amongst healthcare workers, there's something called compassion fatigue, meaning we're seeing these patients day in, day out, coming in sick. We have vaccines available which prevent you from getting severely ill and getting hospitalized, and there's still a significant amount of population that is unvaccinated. So I think as an infection specialist in the community, what I would want to emphasize and get the message out is, if you have not been vaccinated, please get vaccinated, because these vaccines, although they may not be 100% effective, but they do prevent you from dying and getting hospitalized with severe symptoms. If you have 2 doses, please get boosted, because people who have had the booster seem to be the most protected. And we don't really know how long it's going to last. We need to keep our guards up and take all the mitigation measures like masking, continue to follow distancing, and also use our healthcare systems judiciously, because there are also significant amount of non-COVID related patients out there with heart disease, with hip fractures, with bleeding, that we need to keep our hospitals and healthcare system open to take care of them.
Thanks very much, Dr. Padel. Dr. Grover, last thoughts.
Yeah, I mean, you can see my background. In a world where you can be anything, be kind. We are under stress levels beyond what I think we've ever seen. We're seeing more presentations in the emergency department for addiction, for mental health, people who are just distraught with how this has affected their lives. And let's be kind to each other. Healthcare practitioners are under unusual amounts of stress. Omicron's different. We're adapting. We're scrambling. If you come to the hospital, please be nice to your doctors and nurses. We're trying to keep up with everything, and we're going to do our best to treat you with respect that you deserve. I think Dr. Padel covered, great points about the vaccine. I think the other thing here is information can be tough to sift through. I'm obviously biased because I work with Montage Health, but if you have questions, go to the montagehealth.org website. Really trying to get good information about what's available. There are so many questions about what's the quarantine policy, what's my school policy? If you work for a particular company, talk to your employer. What I'm finding as a physician is that company A and company B might have slightly different return to work policies. School A and school B might have different return to school policies. So try to kind of go to your school, your employer, your community, find out what your community is doing, and that also may change. Once again, just to go to a trusted local source of information. Here on the peninsula, I can tell you our public information officer, Monica Suto, has put in hours and hours of work trying to make sure that good information is available. Our whole communications and marketing team has been putting hours of time in to try to make easy, simple, and readily available information. And I know the Salinas Valley and Natividad folks have done the same. So thanks to you and the media community for helping us to get good information out, because that's what our community needs right now.
Thanks for the shout out for the hardworking staff at the hospitals. Thank you both very much for participating today. Great information as always, and we'll hope to have you back again soon. And now we're just talking about schools and contacting your local school if you have questions. And that is a great lead into our next participants. As most people know, school restarting after the holidays, and we're very pleased to have Dr. Rebecca Andrade, who's the superintendent from Salinas City Elementary School District, and Catherine Ballesteri, the assistant superintendent, to share with us some information for families about returning to school and where we are right now. Thanks, ladies, very much for joining us today.
Thank you for inviting us. And joining us here is also our Director of Communications, Mary Duan. Thank you for also being here and participating. Our Salinas Elementary School District is one of the largest in our county, and we have 15 schools. Let me give you a little bit of a context of what we do and what we serve. Preschool through 6th grade, and a couple of our signature programs are the dual language immersion in Spanish at various schools, as well as this year we opened a virtual academy to continue to provide options to our families who were not quite ready to return to an in-person. So that academy is actually thriving in these times. We've been following closely all of the safety procedures. As you all know, we're not quite the experts when it comes to the virus and what's happening in terms of our medical health. We've had to do a lot of collaboration, and for that, we're very grateful to our partners in our community. So based on the CDPH guidance and Cal OSHA, as well as our county, we were able to reopen successfully last year in April for in-person instruction. We continue to ramp up our abilities to provide what is recommended and ensuring that we are aligning it to what we have. So prior to the break, we were testing students and classrooms where there would be a positive case. We partnered with the Clínica de Salud to do that work, and it was happening pretty much daily because the guidance is that every 10 days, twice, would be the classroom tested. Before we go into what are the changes right now, we are offering weekly testing to all of our staff. And prior to the break, we offered self-testing kits to all of our students and our staff. This is the third day back from break, and wanted you to also know that this was the first time that we sent tests to every single one of our staff and students. The data that we currently have is that approximately 16 teachers out of our 400 plus are out at the moment due to COVID, and approximately 500 students are absent due to COVID or COVID related. The governor is recognizing that this is something that is happening statewide. And so last night, he has included another executive order providing more staffing flexibilities to help the school districts be able to continue to stay in-person learning. That includes extending the requirements for the emergency substitute teaching permit. Those have been suspended. So the temporary certificates now can be issued to applicants with a bachelor's degree and a background check. The substitute teaching extension also has gone from 30, then 60 days. Now it's all the way extended to 120 days for any of our substitute teachers. Student teachers previously would have to have a classroom teacher always with them. So right now, student teachers may be assigned to a classroom without the supervision of a credentialed teacher, without the district accruing any penalties. And the retired educators also has been their limitations were there's more flexibility so that we can expand it to longer times. I'm curious to hear about the workforce development later on in this conversation, because we are very much interested in expanding our ability to provide some partnerships and pathways to our local communities there as well.
Well, we can set you up
Yes.
right after the call.
And if I may, I wanted to give our assistant Soup, Katie Ballester, an opportunity to add anything if she wanted to.
Great. Hi, Katie.
Hi there. I think Dr. Andrade covered most of the points. Besides those 16 teachers who are out of the classroom, we have approximately 80 to 90 staff who are out with COVID-related absences. So it does affect our community beyond the classroom, our office staff, our food service staff, our custodial staff. And so we not only are filling in for those classroom teachers, but also for every other level of service to our students and our community.
I would say this is probably a little bit of a stressful time for the district. What can we tell parents about kind of how to interact with their schools, with the schools at this point? Maybe Dr. Grover's be kind, be patient.
Yes, so kindness has been definitely something that we are speaking of constantly through our classrooms and in our themes. But January is the Great Kindness Challenge for all of the state of California. So we are encouraging even more intentionally that piece, care and compassion, just as in the industry that the medical industry was speaking. I believe that our educational leaders and frontline staff, everyone is feeling the effects of just continually having to be through COVID and going through the pandemic and all of the different phases that we are having to do our work while also taking care of children as best as our abilities have. So one of the main themes has been stay adaptable, build resourcefulness, but be mindful of those that are around you, because everyone is feeling the impacts and they're very deep in our families as well as our employees.
I'm also wondering, should we reinforce to parents the communication paths that they should use if they have questions about, what should they do with their child in a certain situation? They have questions about the school. What are the pathways that they should use to get the information they need?
Yes, thank you for that. The district does send a weekly communication giving the information with COVID related, and the school is providing, they are the main point of access for our parents because they know each and every one of their students and families well. So our families should be contacting directly their school if they have any questions. Our website has all of the most recent and updated protocols, and we do send them in our different platforms for our families to also have available. They are always welcome to reach out to the district directly, to myself, to Ms. Ballesteri, to Mary Duan, who is here. So we want to make sure that we're able to provide as much as we can, relieve some of that fear and anxiety that seems to continue to be with us through this time.
And what would be the best way? I'm thinking back to when I had a child in school. What would be the best way now to report a child who is sick, or if the household is sick with COVID? What's the safest way for that?
You report it just as you would do it with any other absence. You let the teacher know, you let the school know. If it is COVID related and we know that the child is going to be out for a while, that's something where human resources does get involved as well. We are very personalized when it comes to these times, and our staff is making those calls directly with our families, with our students, and then following up with anyone that might be a close contact, so that we're able to ensure the safety of everyone.
And I'm guessing report by phone or email, not in person. Correct. We don't have any questions for you, and you've really gone through a lot of information. Are there any last messages or points you'd like to share for parents, for the community, about how schools are really going to make it through a very complex rest of the school year?
We want to be able to, what we give you is what we have in terms of information. It's imperfect. And it's what we have available to us. So that care, compassion, but also the understanding that we're not the medical experts, and that many times we're following the guidance and the compliances from the state as well as the public health office. We understand these are difficult times, and we do realize that it can anger many people, but we really encourage all of our community members to try to maintain the schools, in particular, anywhere where our students are present, as safe spaces for them. What we're noticing is that students are really adapting and doing better when they are with us. The socialization piece is so critical, in particular at the elementary age level, which is who we serve. So we're here to, provide the best services to our students, and we want to be able to let our families know that some of those decisions are not coming from us directly, but from the state and higher authorities.
Thank you all for being on the briefing today and sharing that information. I think, for parents, knowledge is power, even if you don't like it,
Right.
Even if it's frustrating. It's really great to know what is happening. And now, Rebecca, here is your new best friend, Laura Kirshner, with our Workforce Development Board. Laura she is going to give us kind of a happy ending for the media briefing. She has got some information on some really innovative programs for job seekers. So Laura, take it away.
Well, thank you. I certainly hope so. Thank you so much for having me today. I'm putting in the chat how people can contact us, job seekers in particular, because we do have some exciting programs for them to participate in at no cost to them. The first one I want to draw your attention to is the Monterey County Wildfire Restoration Program. And it provides an opportunity to be part of a select group of those that are working to restore the county and the state parks that were damaged in the August 2020 wildfires. Participants will learn how to give back to their community and be paid while learning new skills. It's a 20-week program. It pays $17.50 an hour, and they work up to 30 hours per week for 20 weeks between the hours of 7 a.m. to 6 p.m. Tuesday, Wednesday, and Thursdays. And eligibility, of course, includes those, sorry, that's my home phone, includes those that are 18 years and older. Registration deadline did pass yesterday, but I just was in contact with folks at the office, and they said actually folks have until the end of this week to enroll. So be sure and call the 800 number that I put in the chat if you're interested in learning more. The next one I want to draw your attention to is the Culinary Arts Program. And that is also a let's see, starts from January 24th through July 27th. And that's an opportunity for folks to learn become entry-level cooks or pastry careers in just a few months with an accelerated program that culminates in earning 2 college-level certificates. Specifically, it's the Sustainability Culinary Arts Certificate of Achievement and the Bakery and Pastry Arts Certificate of Achievement. So they learn how to follow appropriate sanitation procedures and personal hygiene requirements to ensure food safety and how to apply culinary principles to a professional kitchen operation. The training program is offered in partnership with Monterey Peninsula College and will be taught at MPC by faculty who have extensive experience in the hospitality industry. Classes are in person Monday through Friday, 8:30 a.m. to 2:30 p.m. And again, that's from January 24th through July 27th. And the registration deadline for that is January 24th. And then the final program I want to draw your attention to, especially for our youngsters, it's for young people between the ages of 18 and 24, and that is the Monterey Cadre Leadership Program. It is a mentorship opportunity which has a stipend associated with it for young people who might not have a lot of job experience, but want to learn those civic responsibilities, those mentorship skills. This is a fun program, and we're getting all kinds of rave reviews. We've had lots of community leaders come in to mentor students, and they learn a lot about civic responsibility, about humanitarian efforts that are going on locally as well as worldwide, and learn how to make an impact in their community. The registration deadline is January 18th for a January 24th start date. So people can learn more on our website, montereycountywdb.org, and then /what's new, and I put that in the chat below, or they can call the job seeker hotline at 1-866-666-9332. Again, these programs are offered at no cost to participants. Great opportunity to get some job skills in a variety of different things. Learn more about what we do. We bring businesses and job seekers together through the employment and training programs through the Monterey County Workforce Development Board.
And stipends as well. That really, that's bread and butter right there.
Yeah, it really is. The Cadre program is a fun program. We've had, let's see, 2 or 3 different cohorts so far that have taken part, local students, local kiddos who have really learned a lot about mentorship, who've been mentored by some great community leaders stepping in to speak with them. They've learned a lot of civic responsibility. They've learned about leadership. So it's a great opportunity for them, particularly if they haven't had a lot of job experience. This is something you can put on your resume. So remember that. The Culinary Arts program is going to be wonderful, and we're looking forward to that one as well. And the wildfire restoration, I can't tell you how many calls I've taken already from people say, hey, I want to sign up for that. So take a peek at the website and then let us know what you're interested in.
Thanks very much, Laura. Those are some great opportunities. And
Absolutely.
I hope people will take advantage of them. And no fair talking about culinary arts during lunchtime when we're doing the briefing. So
I
we're going to
know,
have to.
My
We're gonna
bad.
have to
Sorry.
check your topic schedule before we do this again.
Yes, ma'am. Thank you so much.
I don't have any questions for you. And so we definitely want to refer people to the Workforce Development website for more information on that. And thanks everyone for joining us on the briefing today. It's been really a great informative briefing. Our next briefing will be next week, and we'll see you then.
Great. Thank you.